This is a patient who comes in with abdominal pain, nausea, and vomiting, and we get a CT scan of the abdomen and pelvis with intravenous contrast to evaluate the etiology. As we scroll downwards, we look at the esophagus. We can see that it's distended, it's fluid-filled, and if you start to look at the stomach, you can also see that there's some fluid within the stomach, but perhaps most strikingly, there's a lot of fluid-filled distended loops of small bowel. If we look more distally, some of these loops of small bowel are underdistended or essentially collapsed, and so probably dealing with a small bowel obstruction. Now, the most common cause of small bowel obstruction are adhesions. Another common cause of bowel obstructions are hernias. And so if we scroll downwards in this instance, we can actually see loops of small bowel in the right lower quadrant that are quite distended, and as they go downwards, they are collapsed as they exit into a femoral hernia. The loops coming out of that femoral hernia are also collapsed, and though this is a case of a small bowel obstruction due to a right-sided femoral hernia, we can see some of these findings very nicely on the coronal CT scan of this patient. Multiple distended loops of small bowel, and if you look in the right lower quadrant, you can see that abrupt narrowing right at that femoral hernia, beyond which, when the loops of bowel go upwards again, the loops are collapsed. And so this is a nice example of a small bowel obstruction due to a right lower quadrant femoral hernia.